All right, get ready to explore because we're doing a deep dive today into Paige solo therapy.
Oh, yeah. This was going to be interesting. Lots to unpack.
You brought a ton of info for this deep dive. We've got her website, blog posts, even client testimonials. Wow,
Just someone did their research. It's impressive.
for sure. And it seems like you're looking for support in a really proactive way, which is awesome.
Totally. Taking that first step is huge. Just gathering information like this.
Exactly. So let's start by figuring out who Paige Soleimani is. Her website really gives this image of someone super passionate about helping people through hard times, and her credentials back it up.
Oh, yeah. She's legit a licensed clinical social worker in New York and New Jersey. It's not easy.
Right. That's some serious expertise. Got to give her credit there. But where it gets really interesting to me is her work history.
I was just looking at that. It's quite the resume.
She hasn't just done private practice. There's this whole background in oncology social work, especially at cancer care.
That's got to be tough. It suggests she understands those really heavy emotional and logistical parts that come with serious illness, not just for the patient either, but families too.
And you can tell that's important to her in the areas she specializes into. I mean, like she lists anxiety, depression, the big
First,
ones.
got to cover those bases.
Totally. But then it's like she hones in chronic illness, cancer care, even what it's like being a caregiver. That really stands out.
Those are often overlooked in traditional therapy, it seems like.
Yeah, I see what you mean.
So her highlighting them, it says a lot about how committed she is to supporting people going through these really complex medical journeys.
It's like she's saying, hey, I see you. This isn't just about diagnoses. It's about your whole life changing.
Absolutely. And it's not just talk. Her experience at NYU Langone's Perlmutter Cancer Center and then Cancer Care shows that.
Right. She's been there on the front lines, actually supporting people with cancer, their families, even those who've lost loved ones.
Wow, that's powerful.
So we're starting to get a sense of who Paige is, her experience, her heart, but what's it actually like to work with her? Like if you reached out, what could you expect?
Well, her website really emphasizes a collaborative approach, which I think is refreshing.
No therapist knows best vibes, right?
Not at all. It's a team effort, you and her working together. And on that note, she even offers a free 15-minute consultation.
Okay, that's huge. At least to me, it shows she's really thinking about the client's needs right away. Like, let's chat, no pressure, see if we click.
Builds trust right off the bat. And when you're dealing with serious illness or being a caregiver, that trust is so important.
You're preaching to the choir. No, something that really caught my eye was this article Paige wrote about stem cell transplants. Intense stuff.
Oh, yeah, I read that one. Very powerful.
But here's the thing. It's not about the patient. It's about the caregiver.
You're right, and that's a perspective we need to hear more.
She talks about how they're often forgotten in all the medical stuff, how demanding that role is, and how much they need support, too.
It's like she's shining a light on this whole other side of serious illness that we don't always see.
And it ties back to her focus on a holistic approach, like understanding that illness affects the whole family, not just the person who's sick.
It's all connected.
So we're building this image of Paige as experienced, compassionate, focused on collaboration. But let's hear from the people who really know her clients. Those testimonials, let's be real, can tell you more than any fancy bio ever could.
Totally. It's the real deal, unfiltered.
Right. And some of them are so moving. Like there's one from someone who went through cancer surgery, and they talk about how raw and scary that experience was, the fear of it coming back.
I can't even
They
imagine.
said Paige's support was invaluable during that time.
And the words they use are so telling. Invaluable, supported, empowered. That speaks volumes.
It does. And it's not just about feeling good. This client even mentioned that Paige helped them find a psychiatrist for extra support.
Wow, that's going above and beyond.
It's not just therapy, it's advocacy, knowing that sometimes you need a team to face these challenges, and she helps you build that.
That's incredible.
Okay, so we've covered a lot about Paige already, her background, how she works, what her clients say. But before we go further, I want to pause and ask you, listening, what's standing out to you so far?
It's like she knows what they need before they even say it, which, when you're dealing with something as heavy as cancer, that's got to make a difference.
No doubt. And it's not just practical stuff either. Remember on her website where she talks about what to expect during a session?
You mean where she talks about creating a safe and confidential space? No judgment.
Exactly. She's really intentional about that.
Makes sense, though, given what she specializes in. Takes a lot of courage to open up about these things, you know?
Absolutely. And you can tell she gets that. Even how she structures her sessions, it's smart.
Oh, yeah. Starting with building that trust, understanding your goals, not just some one-size-fits-all approach.
It's refreshing, honestly.
She's all about collaboration. which is key in therapy. It's not a therapist telling you what to do. It's figuring things out together, finding ways to cope.
And ultimately empowering the client.
Exactly. And she's got the tools to do it. She even mentions using evidence-based approaches like cognitive behavioral therapy, CBT.
Which, for those who are new to this, what even is CBT? What makes it so effective?
Think of it like learning a new skill, but instead of baking, you're learning to manage your own mind. CBT gives you actual tools to challenge those negative thought patterns and find healthier ways to cope.
So it's not just about feeling better in the moment, it's about giving you the skills to handle those tough emotions long term.
Bingo. And you can tell Paige is passionate about this stuff, about giving her clients what they need to not just get by, but really thrive.
I love that. So let's say you're intrigued. You're like, okay, this Paige Soleimani, she seems like the real deal. But how do I know if we're a good fit before I take that leap?
Well, that's where that free 15-minute consultation comes in. It's like a test drive for therapy.
I love that analogy because therapy is an investment. You're putting in time, energy, and speaking of investment, let's be real for a sec. Let's talk money.
Got to be practical, right?
Yeah.
And I appreciate that Paige is upfront about her fees. On her Psychology Today profile, she clearly states individual sessions are $200.
Which, to be fair, is pretty standard, especially in New York City. But here's the thing. She also accepts insurance.
Which is huge, makes it accessible to more people.
Right. And she lists a bunch of providers, too. Aetna, Cigna, Anthem, even Horizon.
She's thought of everything.
Seriously. And for those who want to use out-of-network benefits, she offers a super bill.
Like she's removing all the obstacles, because who needs financial stress on top of everything else?
Amen to that. Okay, so we've talked about what she offers, but something else that impressed me was how dedicated she is to virtual sessions.
It's not just a side note on her website either. She's really put thought into it.
Right. She even explains how she makes sure those virtual sessions are secure through a HIPAA-compliant platform.
Got to keep things confidential, especially with such sensitive topics.
So let's say you're thinking of reaching out, maybe you've even had that free chat, and you're wondering, okay, this seems promising, but how long is this going to take? What would you say to that?
The million-dollar question, right? Honestly, it depends.
Of course, everyone's different, but does Paige address that at all?
She does, and she's honest about it, saying it totally depends on your needs and goals.
Which makes sense. Some people might want help through a rough patch. Others might be looking for deeper, longer-term work.
Exactly. And she's ready for both. She even talks about how some people benefit from short-term therapy for specific issues, while others need ongoing support for more complex or long-standing challenges.
It's about finding that balance, addressing what's urgent, and giving people the tools to face future challenges on their own.
And that seems to be Paige's strength. She's not just there to hold your hand, she's teaching you to hold your own.
Love that. It's about empowerment in the end.
Absolutely.
Okay, so we've covered a lot Paige's approach, her expertise, even practical stuff like fees and how long therapy takes. But one more thing before we move on, her dedication to always learning. This woman is like a knowledge sponge.
It's true. And in mental health, which is always changing, that's so important.
She's not just coasting on what she already knows.
Not at all. From creating those lunch and learns for her colleagues at Forge Health to starting that podcast with other social workers, Cancer Out Loud, the Cancer Care Podcast. She's always pushing forward.
And don't forget that article she published in Oncology Nurse Advisor about how important caregivers are during stem cell transplants.
Right. She takes her experiences and turns them into resources for everyone.
Exactly. So we've thrown a lot of info at you, but what does it all mean? What's the takeaway from all this Paige solo therapy digging?
It's got to be more than just making an appointment, don't you think? It's about finding someone who gets it, the tough stuff, someone who's been there. Like Paige, she's not just doing therapy. She's fighting for her clients, teaching other therapists, always looking for new ways to help people through really difficult times.
Exactly. And I think what stands out to me is this compassion. It comes through in everything she does.
It's tangible.
It's like she's saying, hey, you're not alone. And I'm here to help you get through this to handle whatever comes next.
And that's the heart of it, isn't it?
Yeah.
What does this mean for you listening?
We can talk about Paige's credentials and all that, but what matters is how it connects with what you need.
What questions are popping up for you? What are you hoping for in a therapist, especially with what you're going through?
Don't be afraid to really think about it. Even write down some questions for Paige herself.
Yeah, that free consultation is perfect for getting a feel for her style, seeing if that connection is there, because that's so important in therapy.
Because ultimately, you deserve support that fits you.
Finding the right therapist, that's a big step.
It is. It takes a lot. to reach out, to open up like that, to invest in yourself.
Oh, sure.
But as we've seen with Paige, there are people out there who are dedicated to creating that safe space where you can be vulnerable, where healing can happen.
So trust your gut, ask the hard questions, and remember, you are not alone.
That's so important. And on that note, we'll be back next week with another deep dive into a topic you care about.
Looking forward to it.
Until then, take care and keep exploring.